Hello ladies and gentlemen, this is Dr.Haris and this video is the second part of the structure of dentine, and in this video we will talk about the different types of dentine and the general classifications of dentine. So before we move forward, let's have a small recap. Now dentine is the hard tissue that forms the main bulk and the body of the tooth. It encloses the pulp space, it is a resilient and sensitive tissue, and it has the ability to regenerate itself. So, first of all, we will talk about the general classification of dentine. Dentine is generally classified as primary dentine, secondary dentine, and tertiary dentine. The primary dentine is the dentine which is formed before root formation has completed, and it has a very well and regular arrangement of dentinal tubules. It is further subclassified into mantle dentine, which is a layer of dentine immediately adjacent to the enamel and to the cementum. Secondly, the circumpulpal dentine, which is the dentine around the pulp. And the circumpulpal dentine is more mineralized, more hard, and stronger as compared to the mantle dentine, and the purpose of this is to protect the pulp, the vital tissue, and the life of a tooth. Now the secondary dentine, which is also known as the adventitious dentine, is the dentine which is formed after root formation has completed. It has a very less regular arrangement as compared to the primary dentine, and it is deposited very slowly. Secondary dentine, if deposited asymmetrically, especially in the molar tooth around the roof of the pulp chamber and the floor of the pulp chamber, this causes reduction in the pulp space, and this is known as pulp recession. Now in the clinics, before we start any tooth preparation, we have to confirm the presence of the pulp, especially the pulp horns, before we start the preparation. Now under the microscope, the secondary dentine represents itself as a sharp bend in the dentinal tubules as compared to the primary dentine. Now, the secondary dentine has the dentinal tubules which show a phenomena called as dentinal sclerosis. Now, sclerosis literally means filling with mineral. And in this picture, we can see some openings, and these openings represent the patent and open dentinal tubules. But whenever they're filled with mineral, whenever they undergo sclerosis, their appearance becomes like this. And we can clearly see the occluded dentinal tubules. They are filled with mineral. And this increases the longevity and the vitality of the pulp. Now we come on tertiary dentine. Tertiary dentine is that type of dentine which is formed only and only in reaction to some sort of a stimulus. It is also further subclassified. One is the reparative tertiary dentine, and the other is the reactionary tertiary dentine. The reparative tertiary dentine is the dentine which is formed by newly differentiated odontoblasts, which differentiate from the progenerous cells in the pulp. And the other type is the reactionary tertiary dentine, which is formed by the pre-existing odontoblasts inside the pulp. Now, the quality of the tertiary dentine entirely depends upon the intensity and the duration of the stimulus. In case of a destructive stimulus, such as dentinal caries, the tertiary dentine is rapidly deposited. The dentinal tubules are very few, or even in some cases, as observed, there are no dentinal tubules, and it is a very less regular arrangement, and the cells that form the tertiary dentine, they don't even have the chance to escape the dentine during mineralization, and they become entrapped in it because it is deposited so rapidly, and that dentine, which consists of odontoblasts inside it, is known as the osteodentine. Now, when the stimulus is of less intensity, such as a low-grade inflammation, a very well and regularly arranged tertiary dentine is deposited. There are no cells that are present inside it. Now, in this picture, there's another labeling, and that is of the dead tracts. Now, when we talked about dentinal tubules in the previous video, we said that the dentinal tubule has an odontoblast process inside it, and the odontoblast process is a cytoplasmic extension of the odontoblast. Now, in case of some sort of trauma or caries, or whenever dentine is harmed, the odontoblast retracts its process, or in some cases, if the stimulus is very intense, the odontoblastic process degenerates, and that tubule which does not have a process is known as a dead tract. Now we will talk about the classification of dentine according to its position. Like I said in the previous video, dentine is a very unique structure. And the uniqueness comes from the fact that inside the same tooth, the same tissue has different structure in different regions. Now, in this picture, we see the peritubular dentine. The peritubular dentine is the dentine which is surrounding the odontoblast process. And the other dentine is the intertubular dentine. Now, inter means between, and tubular is referring to the dentinal tubules. So the intertubular dentine is the dentine between two dentinal tubules. Now, what's interesting is that the peritubular dentine has more mineral and less collagen. It is more mineralized, stronger and harder as compared to the intertubular dentine, and the sole purpose is the protection of the small odontoblast process present inside it. Now, the intertubular dentine has more collagen, and therefore it has less space for mineral, therefore it is less calcified as compared to the peritubular dentine. Now, this is a clearer picture, and it gives you a better understanding of the difference between intertubular and peritubular dentine. Now, it's important for you to know that peritubular dentine is also known as the intratubular dentine. Okay, so whenever these terms come up, do not confuse between them. There's another type of dentine which is known as the interglobular dentine. Now, this type of dentine is seen in the patients who are deficient in vitamins, especially the vitamin D. And these are basically small masses, small calcified masses, which are referred to as chalcospheroids, which fail to fuse to form a homogeneous mass. They are represented as small, discrete, hypermineralized areas that are close to each other. And this is seen in the patients which have vitamin A or vitamin D deficiency, more commonly in the vitamin D deficient patients. Lastly, we will talk about the clinical classification of dentine, how the dentine is classified in case of a dentinal caries. Now, whenever we have a dentinal caries, we divide dentine into hard dentine, affected dentine, and infected dentine. Hard dentine is the sound dentine which is not destroyed, which is strong, and it does not need any sort of treatment. However, we'll talk about affected and infected dentine in detail. Infected dentine is the dentine which is loaded with bacteria. It is completely destroyed. Under a microscope, its collagen network is totally destroyed, and it is unable to remineralize itself. And clinically, it is easily removable with the help of a spoon excavator or any other hand instrument. Now, the affected dentine is that dentine which is softer than the hard and sound dentine, but it is harder than the infected dentine. Under a microscope, its collagen network is intact and it is capable of remineralization. And it is not easily removable with the help of a spoon excavator or a hand instrument. Affected dentine is the dentine where bacteria have not yet reached. Okay, now in this picture we can see the interproximal area. The interproximal area shows discoloration, but it is not soft anymore. Okay, this is the affected dentine. However, on the pulpal floor, we can see a yellowish, sound and hard dentine. So this was all about dentine. In the last figure, we show a summary, a small summary of the different types of dentine in the form of a flow chart. And this is a very, very important topic. This is the base of dentistry. And I would like all of the dental students to focus and learn the most about dentine as they can, because let me tell you, whenever an examiner asks about dentine or enamel, he expects thorough knowledge, and he would not like, and he'd be very disappointed if you do not know about the basic concepts of dentine and other basic topics of dentistry. So this is a very important topic. Learn as much about it as you can, and feel free to ask any questions in the comments. And if you like this video, give a thumbs up and subscribe to my channel. This is Dr. Haris. Thank you very much.